Electrocardiogram, EKG or ECG. An EKG, or electrocardiogram, is a medical test that records the electrical activity of the heart over a period of time. It is also sometimes referred to as an ECG, which stands for electrocardiogram as well. The test is typically non-invasive and painless and is commonly used to assess the heart's rhythm and electrical conduction. During an EKG, small electrodes are attached to the skin on various parts of the body, such as the chest, arms, and legs. These electrodes detect the electrical signals generated by the heart as it contracts and pumps blood. The signals are then recorded as a series of waves on a graph or digital display. The main purposes of an EKG include 1. Diagnosing heart conditions. EKGs can help diagnose a variety of heart conditions, including arrhythmias, irregular heart rhythms, heart attacks, atrial fibrillation, and more. 2. Monitoring cardiac health. Doctors often use EKGs to monitor the heart's performance over time, especially in patients with known heart conditions. 3. Assessing medication effectiveness. EKGs can show how certain medications or treatments are affecting the heart's electrical activity. 4. Preoperative evaluation. EKGs are sometimes performed as part of preoperative assessments to ensure that a patient's heart is healthy enough for surgery. 5. Screening. In some cases, EKGs may be used as a screening tool to identify potential heart problems, especially in individuals with risk factors such as a family history of heart disease or certain symptoms. Normal EKG interpretation for normal sinus rhythm. A normal EKG, electrocardiogram, interpretation for a normal sinus rhythm typically demonstrates the following characteristics. Rate. The heart rate falls within the normal range, typically between 60 to 100 beats per minute, BPM, for adults. It can vary slightly depending on factors such as age, physical condition, and activity level. Rhythm. The rhythm of the EKG is regular, with consistent intervals between heartbeats. Each RR interval, the time between successive R waves, is the same or very close in duration. P waves. P waves are present before each QRS complex, the sharp, spiky part of the EKG tracing that represents ventricular depolarization. P waves are typically upright and uniform in shape. They indicate atrial depolarization. PR interval. The PR interval, the time from the beginning of the P wave to the start of the QRS complex, is consistent and falls within the normal range of 0.12 to 0.20 seconds, 3 to 5 small squares on the EKG paper. This interval represents the time it takes for the electrical impulse to travel from the atria to the ventricles. QRS complex. The QRS complex is narrow and well-defined, typically lasting less than 0.12 seconds, 3 small squares. A normal QRS complex signifies that ventricular depolarization is occurring normally. QT interval. The QT interval, the time from the start of the QRS complex to the end of the T wave, is within the normal range for the patient's age and gender. An abnormally prolonged QT interval can be associated with an increased risk of arrhythmias. ST segment. The ST segment is typically isoelectric, meaning it is at the same baseline level as the PR segment. A deviation from this baseline can indicate myocardial ischemia, lack of blood flow to the heart muscle, or injury. T waves. T waves are typically upright and have a consistent morphology. T wave abnormalities can sometimes be indicative of cardiac issues. Irregular sinus rhythms. There are several types of irregular sinus rhythms, each with distinct characteristics. Here are 4 common irregular sinus rhythms, along with their differences. Atrial fibrillation, AFib. Characteristics. AFib is characterized by chaotic and irregular electrical activity in the atria, upper chambers of the heart. The atria fibrillate, quiver, instead of contracting effectively, resulting in an irregular ventricular response. Rhythm, irregularly irregular. There is no discernible pattern to the irregularities. Waves. P waves are typically absent or chaotic in AFib. Instead of P waves, there are fibrillation waves or F waves that have no consistent timing. Clinical significance. AFib increases the risk of stroke and other cardiovascular complications. It can lead to symptoms like palpitations, fatigue, and shortness of breath. Atrial flutter. Characteristics. Atrial flutter is characterized by a rapid, regular atrial rhythm. The atria contract at a fast rate, and there is typically a sawtooth pattern, flutter waves, on the EKG. Rhythm, usually regular, although it can become irregular if some atrial impulses are not conducted to the ventricles. P waves, atrial flutter often has regular, distinct flutter waves, F waves. Clinical significance, atrial flutter can also increase the risk of stroke and may cause symptoms similar to AFib. The ventricular response can vary, resulting in irregular or irregular pulse. Ventricular tachycardia, VT. Characteristics: VT is a rapid and usually regular or occasionally irregular heartbeat originating in the ventricles. It is defined as a sequence of 3 or more consecutive ventricular beats at a rate typically exceeding 100 beats per minute. Mechanism: VT often results from an abnormal electrical circuit or focus within the ventricles. This circuit or focus repeatedly activates the ventricles, causing them to contract rapidly and inefficiently. Pulse: in VT, there is usually a detectable pulse. This means that blood is still being pumped by the heart, although less efficiently. The person may experience symptoms like palpitations, lightheadedness, dizziness, or chest discomfort. Clinical implications: VT can be sustained, lasting more than 30 seconds, or non-sustained, lasting less than 30 seconds. Sustained VT is of particular concern, especially if it is associated with significant symptoms or hemodynamic compromise. It can potentially lead to ventricular fibrillation if not treated promptly. Ventricular fibrillation, FIB. Characteristics: FIB is a chaotic and irregular heart rhythm originating in the ventricles. Instead of contracting normally, the ventricles quiver or fibrillate, making them unable to pump blood effectively. Mechanism: FIB typically occurs when multiple, rapidly firing electrical impulses spread throughout the ventricles simultaneously. This chaotic electrical activity disrupts the coordinated contraction of the heart muscle. Pulse: in FIB, there is no detectable pulse. The person loses consciousness immediately, and blood circulation ceases. FIB is a medical emergency. Clinical implications: FIB is a life-threatening condition that leads to sudden cardiac arrest. Without immediate intervention, it is almost always fatal. FIB often occurs in individuals with severe underlying heart disease or as a complication of other arrhythmias.